Good morning, everyone. My name's Casey, and today I will be talking about decriminalizing personal drug possession and why I think Ontario should take action. To begin, I would like to say that, of course, thank you everyone for having me today. Specifically, my presentation is directed towards the Honorable Miss Sylvia Jones. I really appreciate you being here today and for, paying attention and listening to what I have to say about this issue. So, to begin, I'd like to say a little bit about me. My name is Casey, as I said. I am a social service worker, and I am also an Algonquin College social service worker graduate, and I am currently completing my last semester of my Bachelor of Social Work. Today, I'm going to be talking to you all a little bit about Bill C-5. So, in case you didn't already know, Bill C-5 is an act that was passed in 2021 to amend the Criminal Code and Controlled Drugs and Substances Act. This bill reduced penalties for people who possess small amounts of illicit substances for personal use. But before we get into that, I'd like to ask, does anyone know what is considered an illicit substance? For me, what comes to mind right away is, heroin, cocaine, LSD, ecstasy. But this also includes medications such as antidepressants and tranquilizers, anabolic steroids, There's lots of things that are considered illicit substances. And with this in mind, I'm just wondering if anyone knows how many Canadians use illicit substances. Well, the number or the percentage of people or of Canadians who use illicit substances is actually 21%. So almost a quarter of the Canadian population use or have used illicit substances. Now, what is BC doing about this? Well, since Bill C-5 was passed, BC has worked hard to start reducing the stigma associated with substance use. They have been granted a 3-year exemption under the CDSA, which is the Controlled Drugs and Substances Act, and that from now on I will refer to the Controlled Drugs and Substances Act as the CDSA. So they have removed criminal penalties for people who are carrying 2.5 grams or less of an illicit substance. And on top of that, not only will they not be criminalized, but their drugs will also not be seized. Now you may be wondering, well, what are they doing instead? So instead of criminalizing people that are carrying illicit substances for personal use, individuals will actually be provided with information on available health and social supports. And if requested, they can also be referred to treatment. Now, you may be wondering why I'm telling you this and what does it have to do with race? I'm bringing this up because structural racism is very prevalent in our criminal justice system. Racialized communities face great barriers in accessing treatment and harm reduction services. Actually, Black patients are less likely to be referred to treatment than non-racialized people, and they're also less likely to be provided naloxone or evidence-based medications when needed. In addition, racialized community members often have adverse experiences with treatment services, and this results in lower treatment completion rates and worse health outcomes. This data is from the Ontario Public Health. And to add to that, according to a study done by Statistics Canada in 2019, Black people actually report experiencing racial discrimination at alarming rates within the criminal justice system. Discrimination based on race and skin color was experienced by 41% of the Black population compared to only 3% of the non-racialized population. This is absolutely not okay. So to give you all a little bit more insight, in perspective, I have a few statistics to tell you. So, Black people actually represent 9.2% of the total incarcerated population, despite representing only 3.5% of the Canadian population. So I'm going to repeat that. 9.2% of the total incarcerated population consists of Black people. However, 3.5% of the Canadian population represents Black people. This is highly disproportionate. But not only that, 45% of people admitted for offenses under the CDSA are Black. That's almost half of the people admitted for offenses under the CDSA are Black people. And not only that, that's more than half, although they only represent 3.5% of the Canadian population. Now, as you can tell, these numbers are highly disproportionate and are a huge reflection of systematic racism present in our criminal justice system. Yes, so what do I propose that we do about this? Well, I think that the government of Ontario should also request an exemption from Health Canada under the CDSA, as did BC. So I'm sure you're all wondering, how much will this cost? Because we all like to talk about numbers here. Well, the criminal justice system is actually anticipated to save money. So, for example, in Portugal, the percentage of convictions for drug offenses lowered from 40% to 15% when they passed this exemption for personal drug possession. So again, from 40% to 15%, which obviously alleviates a lot of pressure on the criminal justice system. So I'm sure that all sounds great. You know, we're going to save money. It's going to help. It's going to help people. It's going to break down systematic racism. However, how will this work? Well, the funds that we save from the criminal justice system can be reallocated. So I propose that we create a robust plan for training the police. This can be like a webinar where we explain to the police what has happened with this bill and what the systems are in place moving forward and how to address these kinds of situations. Because BC has already paved the pathway for us, this is a pretty easy plan for us because they've already started educating the public. Educating the public is something that I think is essential for us to do. There's a lot of stigma already surrounding substance use and substance users, and so educating the public and following British Columbia's lead may be extremely beneficial for our province. And I also think that we should engage stakeholders from Indigenous and racialized communities in conversations surrounding decriminalization. You know, because in Ontario, we actually do not have very many culturally appropriate services available for racialized communities. And it would be very, very important for us to start engaging stakeholders such as chiefs of Indigenous reserves or communities and stakeholders in racialized community organizations and ask them, you know, what can we do with this in mind to help populations that are struggling with substance use? You know, how can we do this in a way that is culturally appropriate and sensitive? And with the money that we're saving from the criminal justice system, there's no reason why this can't work. So, I'd like to add that this may all sound very scary. You know, it's a big move, and people may be scared that there's going to see increased rates of substance use. You know, people are probably scared that people are going to start experimenting. However, there's actually evidence that shows that other countries have not seen increased rates of substance use since decriminalization. So like I talked about Portugal earlier, Portugal's rates of substance use and overdoses have actually remained below the European Union averages, and they are the only country in Europe that has decriminalized personal drug possession. So really, I don't see any reason why not to move forward with this and implement these changes. Um, so just to summarize, we all know that BC's plan is there and it's ready for us, and we can follow suit and start becoming a more accessible and inclusive community, or sorry, province, and we can start breaking down systematic barriers that disadvantage people of color. Um, let's do this together and let's fight racial inequality in the criminal justice system. And while we're doing that, let's take the cost savings that we're given and you know work on making this a more inclusive Canada. So thank you all for having me today. My name again is Casey, and that is my email as well, caseydunn@cmail.carleton.ca. If you would like to send me an email to chat more, I would be more than happy to chat with you all. Um, and yeah, if you have any questions, just please, please, please feel free to let me know. And thank you so much for taking the time to listen to me today. It's very, very appreciated. And I look forward to hearing from you all about what we can do moving forward and where you're at with this in the next couple of months. So thank you so much, and have a wonderful rest of your day.